Okay. You're center.
We're good?
Yeah.
Excellent. All right. Welcome to Fertility Fact or Fiction, everybody. I think we're just getting some people loading up. Oh, there we go. Hello. Welcome to Fertility Fact or Fiction. I'm your host, Dr. Rahi Victory, and tonight we have an interesting show because we finally have an article worthy of discussion, and we have an interesting question to pose to you all, much like we did last week about the bear. We got a question that hopefully we think you guys will find interesting. So we're going to let everybody jump on, and then we'll see how it goes. Oh, it just asked me to invite you to come on live. You're already on live.
You missed me.
So we're going to take a couple of minutes. I'll do the usual and give you guys some updates. It is official. We have Dr. Shireen Rahal joining us soon. We're just creating her bio. Tarek and I are going to work on that and get her up on the website. She will be here as of July 15th after the very noble and wonderful Dr. Pattinson will be retiring from practice for good. So we're very excited to have Shireen. St. Catharines should be open hopefully around June, I think. I don't want to make any promises I can't keep, but we're hoping it'll be ready then. And we'll have our Woodstock clinic open soon as well. Yeah, that was the exciting stuff. We are doing the highest number of IVF cycles that we've done yet. So I'm super excited about that. And yeah, overall, very, very happy about everything that's going on. We are working on our team. We're working on our personnel. We're working out the kinks and protocols, loads of success with our patients. So we are super happy currently with everything that's happening. I just got back from Berlin, had a wonderful meeting there and a great conference. And then we are heading out to England next for the London Fertility Show. So excited about that. And my wife and my daughter are there because my daughter is checking out her medical school. So if any of you have any opinions on whether or not you should go to King's College, University of Edinburgh, or University of Glasgow for medical school, please put in your vote now, and I will tell my daughter that that's what everybody's vote was. I don't know if you can put up a poll in the middle of this or not, but it would be King's College, University of Edinburgh, or Glasgow, University of Glasgow. So, yes, and a huge shout out to all the nurses out there for Nurses Week. Thank you for all your amazing effort and your tireless, efforts and all the work that you do behind the scenes, in front of the scenes, with patients, with doctors. Thank you most of all for putting up with us. We are not the easiest group of people to put up with. So we appreciate you and everything that you do. And Lord knows I would be nowhere without my team. And special thanks to Lisa, our nurse manager, who has been an absolute force of nature for us. So thank you to everyone who is a nurse, and thank you to all those of you who are out there who are nurses, and to the future nurses that we will be hiring, because we're getting at least one more right now, and then hopefully finding a few more as well. So yeah, things are going great. Hopefully you guys had a good week as well, and we have an exciting show for you tonight. So I'm going to start the show off.
Glasgow Kings, and what was the third one?
Edinburgh. Yeah. So I'm going to start the show off with a question that we came up with because Tarek was showing me a clip from Curb Your Enthusiasm, in which Vince Vaughn, who plays
Freddie Funkhauser.
Freddie Funkhauser, talks about the fact that his next door neighbor has asked him to have sex with her, even though she's a happily married woman, because the partner sperm isn't good enough, and so they want to conceive a child, but they want to conceive naturally because for some reason they think that's better. And so the husband,
between
right, he thinks that the baby and the mom and the biological dad should have a more intimate relationship, and so she wants to have sex with him. But they're supposed to have all these ground rules about how it's supposed to be very clinical. And he goes on in a very humorous way, talking about how it's like the best sex he's ever had, and there's explosions and fireworks and all this stuff. And so we thought for a minute, well, wait a second, what if he had a partner? And so we're posing this question to you guys, mostly because the bear question last week was so exciting. So we want to see what everybody says. So, first of all, what do you think about the fact that he's having sex with his next door neighbor to help them get pregnant? And then, second of all, what if he had a partner and the partner didn't want him to? What would you say if he was your partner and you didn't necessarily want him to do it? Or better yet, how would you feel about it if he said, I want to give my sperm to this woman, not necessarily sexually, but donate it, right? So, interested in your thoughts. We are open to a discussion of this. I thought it was a wild scenario, and it definitely made us laugh. But then we thought, well, wait a second. Should this be okay? And how would other people feel if it was their partner that was doing this? So, any feedback would be much appreciated.
No way.
No way.
No way.
Interesting. I would run. Would you run? This is Sands. Would you run too, or would you run away? Would you be willing to let him do it, or would you not be willing to let him do it?
It's the sperm donation. I think it has to be
It's
clear.
the sperm
They
donation.
know for
Yeah.
sure no one's going to let their significant other.
Right.
Yeah, we're not assuming that.
We're
But
not talking
donate the
about
sperm.
sex,
Yeah,
but
yeah, yeah.
but would you let him donate the sperm to the neighbor, even if it wasn't sexual? Just giving it to. Oh, Sands is saying she would run too.
Yeah.
That's interesting. All right. Any other comments?
There are home kits for this.
Yeah. Okay. But would you let him do it? I know there's home kits. We're not talking about having to have sex with the neighbor. Just would you be cool with your partner donating their sperm to the next door neighbor? That's the question.
That's the question.
That is the question. Okay, well, look for answers while we review this article. So, thank you all for being very patient. I do have to say it's been probably 2 months since we had a decent article to review, but we finally found a good one for you. There really just hasn't been that many that have been good. But this one's good. So, this is from Reproductive Biomedicine Online, RBMO for short, and it's called The Impact of Transferring a Poor Quality Embryo along with a good quality embryo on pregnancy outcomes in IVF ICSI cycles. Why is this important? Well, I get asked all the time, what do we do if we want to do 2 embryos? And what if we only have 2 and one's good and one's not so good? Can we transfer both at the same time? What's going to happen? Am I going to get a better outcome? Am I going to get a worse outcome? What's going to happen overall? And so the question is, what should you do under those circumstances? You got your 4AA, and then you've got your like 3BC or CB. Is the 3BC going to negatively impact your 4AA? Great question, right? So there have been previous articles on this. They said it does not impact things. But this is a Chinese study. And the one huge advantage of every single Chinese study out there, massive numbers, huge numbers. We can't even come close to those numbers in North America because they are doing umpteen million IVF cycles per year. I knew one fertility specialist that opened up a clinic in China. They had to pay $45 million for the license.
Wow.
Just the license, okay? But they had to build a 500-bed facility because the province that they were building it in had 30 million people in it, and they were going to be the IVF center for 30 million people.
Wow.
Right? So, yeah, crazy. Like, wow. So anyways, we can screen share. Am I already sharing?
Yeah, you're good.
Okay. So here's the article, Impact of Transferring of a Poor Quality Embryo along with a Good Quality Embryo. So let's flip over and I'll show you what they did. Here's the abstract. So this is a retrospective cohort, so that's important. They went backwards and looked at their data, but they included 11,738 women, big numbers of people. All of these women underwent IVF and ICSI, and they received frozen embryo transfers at a tertiary care academic medical clinic, and it went from 2015 to 2022. Study population was split into two groups: those that got single embryo transfers, what they called SBT, single blastocyst transfer, and those that got double blastocyst transfers, or DBT. Okay, so the single was 9,338 and the double was 2,400. And when they did the double, they selected the group that had one good and one bad. Okay, so let's take a look at what they classified as good and bad and so on. So I'll just blow this up a little bit for you. So these were women who got single blastocysts. They were in their first IVF cycle with no other factors affecting pregnancy. There were patients with uterine factors that made them unsuitable for twin pregnancies, like a scarred uterus, cervical weakness, or a history of twin pregnancy with miscarriage or preterm birth. Patients whose overall condition was not suitable for twin pregnancies, like those that had problems with systemic diseases, or those with a really short height or a very, very low weight, less than 40 kilograms. What adult do you know of that's less than 40 kilograms?
40 kilograms.
Yeah. I need to lose 40 kilograms at this stage. Okay, so that was it. So the next group was the double blastocyst transfer. So these were the patients that didn't meet the criteria, obviously, for single. They had had miscarriages or repeated implantation failures and advanced age. There are patients who insisted on the transfer of two embryos. Who did they exclude? And this is critical. No one that got an egg donor cycle. And interestingly, no one that got PGT. I don't know why they did that, because it would have been way better if they had done it with PGT, but they didn't. No one with an abnormal uterus or untreated endometrial polyps, and no one that used frozen eggs or embryos that were frozen very early on. And so they did get some cycles that were lost to follow up, but overall they ended up with 11,738 women in the study. So what did they find? I'm going to skip ahead to the graphs and review that with you. Oop, there we go. Okay, so what can you see here? Maternal age, not statistically significantly different. Infertility duration, it was statistically significantly different, but it's actually not numerically different. This is important to understand. When you have 11,000 patients in the study population, a 3-day difference could be statistically significant. So it's not clinically relevant, but they did find a difference there. Infertility type was not significant. Fertility cause was not significant. Endometrial thickness was, but it's 10.4 in the single group versus 10.16 in the double group. I mean, that's not clinically meaningful, so I'm not worried about that at all. Fertilization type, whether it was IVF or IVF with ICSI, that was statistically significant. But again, you're talking about a 3% difference. So I don't know that that's clinically meaningful, but it was statistically significant. Very slight borderline change in the number of patients that had previously been pregnant, and then a big difference in the endometrial preparation protocol. So 6% more, 6.5% more had natural cycle transfers in the single blastocyst transfer group than they did in the double. Most of them, about half, had HRT protocols, and then 20% got a Lupron shot with a HRT protocol, a hormone replacement protocol, in the SBT group versus 30% in the DBT group. So there were some differences in the endometrial preparation. They let the doctors basically treat people the way they wanted to, and because this is retrospective, you can't standardize. So take the results with the grain of salt that it deserves. Okay, so what about this graph? This is important. So implantation rate, 70% in the single blastocyst transfer group versus 59% in the double. Now, keep in mind, the implantation is the number of embryos implanted based on how many you put in there. So 70% of the singles did, but when you put in two, there is a statistically significantly lower implantation rate. And that's obvious because some of those bad embryos won't work, right? So you kind of expect that, but at the same time, it's worrisome. You couldn't figure this out unless you did a true randomized controlled trial. But the reality is that it does appear that you're going to get lower implantation rates. However, the clinical pregnancy rate, meaning they could see a heartbeat, was a little bit higher, almost 9% higher in the group with the double blastocyst transfer rate. So they got a very high rate of clinical pregnancy, 76.7% versus 67.3. Miscarriage rate actually lower in the double blastocyst transfer rate group. Very surprising. You would expect that the ones that are getting the abnormal, not abnormal, but the weaker quality or poor quality embryo would have a higher miscarriage rate. They did not. It was actually the other group that did. Live birth rate, definitely higher, again, almost 9.5%, higher in the double blastocyst transfer group. The multiple rate, though, look at the difference. Okay, so in the group that got one embryo, 1.8% of them had a multiple pregnancy. Now, that by itself is a huge number because typically it's 1 in 300 that split. So your rate should be 0.3%. So this is much, much higher than that. It's 6 times higher than the normal background rate, which is a lot. But then look at their rate in the group that had, the actual double embryo transfer rate, 41.4%. So you have this huge number, even with untested embryos, that ended up with um, a genetically or not genetically, sorry, with a twin pregnancy or multiple pregnancy. So huge number, very, very concerning. So the other thing, gestational age at birth, very slightly earlier in the multiples, obvious. I don't think that's a big deal. Birth weight, a little bit lower in the multiples. Again, not a huge issue. Cesarean delivery rate, a little bit higher in the multiples. Again, that makes sense. Preterm birth rate, huge factor, way higher, 3 times higher in the group that had multiples compared to the group that did not have multiples. So all of these things need to be considered. Yes, you're getting a higher live birth rate, but you're taking on a higher preterm birth rate, you're taking on a higher cesarean section rate, lower birth weight, and you're looking very much at the potential that the implantation rate is actually lower. I need to get out of the pencil marking part of it. Okay, so then they did it by univariate analysis. So they took each individual little factor. And the things that they found that were significant for success were double blastocyst transfer, maternal age had a very big impact. The body mass index had an impact. The endometrial thickness had an impact with an 11% difference between the groups. The infertility type, secondary versus primary, secondary reduced your chances, which I found kind of interesting. You'd actually think those people would do better. They did worse. Infertility cause, if it was female factor, it was significant. If it was unexplained, it was also very significant. Hormone replacement therapy protocols did have the lowest success compared to natural cycles. So I harp on this all the time. Everybody out there is still using your hormone replacement therapy protocols. They're garbage protocols. Stop using them. Go back to doing natural cycles. It's much better, or letrozole, which is even better than natural. And then the number of cycles you had done, the number of times you had been pregnant, and the number of times you had delivered all had a very significant positive effect on the success rates. The last, there should be another one. Yep, there we go. The last thing is that they did this overall analysis controlling for all the different factors. So when they did that, what they showed was in the first adjusted model, which was adjusted for maternal age and BMI, you had almost a 50% increase in live birth if you use the double embryo transfer. So that is a big number, a very, very big number. And then at the same time, if you controlled for every other thing, like basically the endometrial preparation, the fertilization type, cycle number, all those things they found significant in the former table that I showed you, they actually found a 55% increase in live birth rate. So should everybody be asking for a double embryo transfer? Well, the answer is no, you should not all be asking for a double embryo transfer because there are risks that come along with having twins. Maternal risks, hospitalization, stillbirth, miscarriage, bleeding, hypertension, preeclampsia, gestational diabetes, need for operative delivery. Fetal risks, if they come early and they come very early, you have all sorts of complications with the pregnancy. I won't list them all off, they're terrifying. And then social risk, because it's an 80% divorce rate when you have twins. So it's not all fun and games. There are side effects and impacts from this stuff. But if it's imperative for you to get a higher success rate, you will actually get a higher success rate, even if you're transferring a bad embryo with a good one. So for those of you that are kind of in desperation mode, or maybe you haven't done PGT on your embryos and you're older, it may actually be beneficial to transfer two rather than one. Is it enough to make me change my mind about what we're doing? It might be. I mean, we're bound by regulations with government funded cycles, but for the other ones, if we don't have PGT testing, it may actually be a prudent thing to consider doing double embryo transfers instead of single if the patients are prepared for the impact of having a very high rate of having twins. So not all fun and games, there are risks, but it's worthwhile having that discussion with your doctor. So is it a fact or fiction that it's safe to transfer a single good quality embryo with a single bad quality embryo? It is a fact that it is safe and probably improves your live birth rates, but does have some negative side effects. Hope you enjoyed that part of the show. We are still looking for answers on whether or not they let their partners. Did we get many?
Oh, you got a lot.
Oh, really?
It's just a lag.
We should have put up a poll. So yeah, we want to know what your thoughts were about letting your partner donate sperm to the next door neighbor in a non-sexual manner.
No freaking chance.
No freaking chance.
Unless loot bag of money. Maybe for them to pay for my treatments.
Oh, there we go.
Hard no. I would let him donate, but not directly into the recipient.
Okay, yeah. Well, I get that. I mean, we're not talking sexual, non-sexual.
Yeah.
Hey, Kelly. Kelly's on TikTok.
There we go. Yeah. That's and then on Facebook, everybody was just like, no way.
No way.
No way. Not a chance.
So what if it's the woman? What if it's a male and a female together and the woman wants to give her eggs to somebody else? Is that okay if the partner doesn't want you to? If the guy doesn't want you to donate your eggs, can you as a woman still donate your eggs?
Oh, another question. Curveball.
Curveball. Let's find out. In the meantime, we'll start taking your questions. Put up a poll. Should a woman be allowed to donate her eggs if her partner doesn't want her to?
All right.
Can we do that?
Yeah. I can put it on.
On TikTok, you just got to tell us. Yes. Oh, look at that. That's totally sexist. So a woman gets to donate her eggs, but the guy can't donate his sperm? Okay, somebody's going to need to justify that one for me. I want to know why the guy can't, but the woman can. Oh, it's too funny. I say no. Okay, but that's totally unfair. I feel a little assaulted here right now. This is not fair.
If a woman can donate her eggs, just join when the person was asking if the woman can donate their eggs. Didn't hear anything about the dude donating a sperm.
Okay, so the whole story was that Vince Vaughn in Curb Your Enthusiasm is invited to basically have sex with his next door neighbor because the partner of the next door neighbor, the husband, can't provide sperm and they want it to be natural. So we're not asking about having sex with your next door neighbor, but would you allow your male partner
Factor Fiction at night
after dark? Yeah.
After dark.
Would you allow your male partner to donate in a non-sexual manner sperm to your next door neighbor, and vice versa? If your partner didn't want you to donate eggs, should you still be allowed to donate eggs to anyone you wanted to? Let's say your next door neighbor. So that's the question. All right. So let's go to some medical questions. While you're doing your poll.
Yeah, sure. Let's see what the people are saying. All right, scroll up a little bit here. Okay. Hi, Fabulous Team, Dr. B. What do you think of estrogen priming for the older DOR patients?
It's useless, proven useless. There's a randomized controlled trial we reviewed on the show God, it was probably a year ago now, and I re-reviewed it recently. It's useless. It doesn't help anybody. And there was a trend towards decreased live birth, so we don't do it. Yeah, it doesn't help anybody. The odd time, like maybe once or twice a year where nothing else works, I'll try it, but it doesn't, like the randomized controlled trial shows that it is not beneficial. Yeah, I tell my husband to bring a turkey baster. Absolutely not to both. Oh, okay. See, that's interesting. That is interesting. Yeah.
The answers we find are interesting, I'm telling you.
I don't do low estrogen at all to prime. It's proven useless. Randomized controlled trial out of China. No benefit to estrogen priming. Literally none. Not an increase in eggs, not an increase in outcomes. A trend towards worse outcomes. So I don't do it.
As far as donating eggs or sperm, I mean, in a vacuum, you have to say no. Imagine your next door neighbor had a kid and it's yours.
Awkward, right?
Awkward.
So,
Awkward.
super awkward.
Super awkward.
Yeah. I mean, how would you not want to hug and
He's
kiss?
walking around and he looks just
And-
like you. You're like, yo, right?
Yeah, I know. It'd be wild.
Should be a mutual decision.
What do you use? What do you use with letrozole to prime? So if I'm priming, I use testosterone and human growth hormone and DHEA. We don't use estrogen. Yeah. If I'm priming, I don't prime everybody.
Jumped the gun there. Hello, Dr. T and staff.
Oh,
This guy's great.
ouch.
This guy's
Yeah.
phenomenal. I love
Yeah,
this man.
I'm just gonna take this syringe and all
You
right,
suggest starting prednisone early prior to transfer.
5 days prior. Yeah, even T could have answered that one.
I was
so-
about to.
Yeah, I just
Stole the
jumped.
words out of my mouth.
Yeah.
Hi, Dream Team. For patients over 43, how big is the leading follicle when you decide to trigger?
Over 43,
Yeah.
17, 18. You want to be a little bit smaller. So that's when we aim for it.
And a question I'm thinking is, are you a fertility doctor?
I am a fertility doctor. I am a double board certified American and Canadian licensed fertility specialist, reproductive endocrinology and infertility. Yep.
I like to have a little bit of fun.
There you go.
There you go.
Yeah.
Hi to both.
Yeah.
Dr. V,
Yeah.
are you able to talk to the benefits or risks of using LDN in FET cycles? Is this a med that's used in Canada ever? Thank you.
I looked it up. There is some evidence that supports using low dose naltrexone for fertility enhancement. And it's not unreasonable. However, I wasn't convinced by the data yet. I think they need to do a bigger, better trial. And I think we're using so many different things right now to help people. I'm not convinced that's the one that's going to make the biggest difference. So I haven't used it yet. We should probably do a video on low dose naltrexone. I'll put together a video with T on low dose naltrexone. Yeah.
Where are you located, may I ask? Looking to do my third IVF.
We're right across the border from Detroit and Windsor, Ontario. We are super easy to get to from anywhere in Canada and the US because of our location. We also have locations in Sarnia, which is right across from Port Huron in Michigan. And we have 2 locations opening up in St. Catharines and Woodstock.
There we go. Placenta previa at 20 weeks. Can I still go on a trip?
Placenta previa.
Placenta previa.
Yeah.
At 20 weeks, can I still go on a trip that will involve a lot of walking? Oh, risky.
Yeah, Tarek's saying risky, Dr. T. Listen, you're taking substantial risks. I'm not going to tell you yes or no because I'm not getting in any legal trouble with this one, but I would tell you to talk to your doctor and see what they say. I can tell you that if you were my patient, I would say no. Placenta previa is a life-threatening condition, and you can bleed at any time. Granted, it's unlikely at 20 weeks. However, I would not want you to be somewhere where you couldn't get rapid access medical care and high-quality medical care. So I'd be very worried about someone traveling with a placenta previa. You're clicking.
A lot going on here. Hello, doctor. Can
Yeah.
testosterone priming work for PCOS women? What NG is ideal just so to monitor it won't be too high while on testosterone gel.
You shouldn't, if you're PCOS, you should absolutely not be taking testosterone. There is one guy in the US that swears up and down that women with PCOS need DHEA to stimulate properly, but no one has corroborated those results, like literally no one. So we don't do it. And I don't know why on earth you would ever go on testosterone if you were dealing with PCOS. So that doesn't make sense to me. Maybe explain the thinking behind that. I'm not sure. Do I really think acupuncture makes a difference with fertility rates? Yes, if it helps relax you. There are multiple randomized controlled trials of acupuncture for fertility. The overall gist of it, if it relaxes you, it's beneficial, and if it doesn't, it isn't. So I had only had acupuncture twice, both recent. My whole back was in spasm. I was in agony. I could barely walk. And the first time I had it, it really did nothing for me whatsoever. But I also didn't feel the needles going in. Like I literally didn't feel them going in. The second time I did it, holy cow, did that hurt. It was not comfortable and it worked great. So God bless both my naturopath and Natasha for trying. And it worked phenomenally well. So I don't know if you're watching, Natasha, but I will forever be indebted to you. Yeah. And you too, Jen. I love you as well. Question?
Sure. Hi, Dr. TNV. If you have HSV type 1
Yeah.
with rare outbreaks,
Yeah.
can you kiss your baby in the first few months while they are still developing their immune system?
Oh. If you're having an outbreak, you definitely shouldn't. But if you're not having an outbreak, sure. Yeah. You're only generally shedding if you have an outbreak.
How can you test DQ alpha matching with donor sperm?
You can't. You have to get the donor's blood.
Hello, dear Dr. Victory and dear Tarek. Is it okay to take 2.5 milligrams of letrozole for FET when it shows a bad impact on the growth of the lining? Sense of letrozole having lining problems at all?
So we don't get into lining problems with letrozole, but if in you it's causing a problem, I wouldn't use it, right? Like, I mean, everybody's different. So we never advocate for everybody doing the same thing every time.
Hi, Dr. VNT. My RI asked me to do some thrombophilia tests,
Sure.
but I was on baby aspirin until 7 days ago.
Okay.
Do you think aspirin can alter results?
It can, but very slightly. It shouldn't because the main effect of aspirin is on your platelets, and thrombophilia tests don't test platelet function. So it's unlikely there'd be a huge impact, but just wait 21 days and then do your test because aspirin only stays in your system for 3 weeks. You're laughing. Why are you laughing?
Your shows.
Bonkers. I want to know what people said.
Oh yeah, no, that subject, the door has closed.
The door is closed.
Yeah, but there's a lot of people you can ask that to right now.
Okay.
There's a
I
ton
still
of,
want to know what people think of. Yeah.
yeah, there's a lot of people right
Is
now.
it normal to start on letrozole 5 milligrams instead of 2.5? I don't have PCS, but do have endo. We don't bother with 2.5. We go straight to 5. Yeah. That's for Shaylee. Oh, what a beautiful name. I love that name. Shaylee. Oh, I love that.
Good evening, Dr. T and Dr. V.
Oh, you're really coming up, man. Like you're in the next level the last couple of weeks.
Thank you.
Yeah. I'm
Thank
glad
you.
I got to be part of quote unquote the team.
Yes, welcome to the team. Absolutely. You're a key asset of the team, by the way. Many things I rely on you for. Many.
Like medical information.
Medical information to start with. Absolutely. Basics.
Basics. All right.
Yeah.
Yeah.
Good evening.
Yeah.
What are some possible treatments for high prolactin? We did once a week
Dostinex,
cabergoline for
Yep.
6 weeks.
Yep.
That brought it down to 7 nanograms per mil from 69.
Oh,
But it went back up again to 30. MRI is a 6-month wait still. How would you treat this?
I just stay on the cabergoline. You shouldn't come off. Once you come off, it pops back up. Just stay on it. That's easy. Yeah. Now, if it's up while you're on cabergoline, I'd start being nervous about the fact that you have a pituitary macroadenoma. That's more serious because it does need surgery. So you shouldn't need to wait 6 months. You should be talking to a neurosurgeon and they should be getting you an MRI quickly. Off screen, Tark is going like this. So I don't know what's going on because we got a lot going on off screen here, but he'll tell me later. Big show, I think, is
Big
what he's
show.
trying to tell me.
Big show.
Yeah. Oh, wait, can I take this one?
Sure, go ahead.
What are my thoughts on the Emma and Alice test? So I love the idea that it's important to check the uterine and vaginal microbiome. No question. Anybody that tells you that it isn't important doesn't know what they're talking about. It is clearly not just important, but probably critical to your success. However, you have to do a biopsy for their test, which is not fun. It's very painful. And I just don't trust everything yet from my genomics because they're still telling people to do the ERA test. And we know, even they know that the ERA test is useless. Their own trial showed that it was of no benefit. So I have trouble with that. Like if they lay the ERA test to rest, I probably believe in the rest of what they're doing a bit more, but I don't love it right now. Yeah. Okay.
Can I get a cortisone shot in my hip prior to an FET or during pregnancy?
Sure. No problem. Fire away.
Hi, Dr. V.
Literally and figuratively. Oh, they left you out for once.
Completely out.
Hey, I'm back on.
I was thinking about even answering the question. Not even asking.
I'm back up to bat. I love it.
Can we use Viagra vaginally for increased lining in FET cycle with little or no E2?
Yes.
I was going to say yes.
You were going to say yes?
Didn't need a Dr. V for that.
Yeah, vaginal Viagra actually has pretty decent evidence for thickening your lining. So
that was an episode. That's
an episode.
Women can use Viagra. That's
all right.
Unbelievable.
From now on, Tarek's going to try first, and then I'll.
No. We'll let you swing. Don't worry.
Any supplements to stop after FET? Nope. Don't stop your supplements. Pregnancies don't like yo-yoing. They don't want to go up and down. So just keep everything nice and balanced. Don't change anything.
How long does it take for lit side effects to settle down? My arm looks horrible after 1 week. Huge red bumps that hurt when you touch them.
Is that Jana?
It is.
It is Jana. Hi, Jana.
You're good. You are the
doctor. Yeah, so my lovely German friend, yeah, it should settle down fairly quickly. If you're having that kind of a reaction, your body's probably mounting a big response to it. So you probably have a very strong anti-paternal antibody response. But you can take Tylenol at this stage if you're having a lot of discomfort. In Europe, I think it's called paracetamol. I don't think you have Tylenol, but you can take paracetamol. So try that. And I'm sorry your arm is sore, dear.
What do you think of the carnivore diet for trying to conceive and or pregnancy?
Okay, so I've been waiting for someone to ask this.
Cheers.
So there is a very famous individual with a massive fertility program who tells people that they should exclusively eat, I don't know, cow heart and God knows what else. Meat only, eat the carnivore diet, and only eat once a day. And apparently claims that there's all these benefits to doing it. A stick of butter. In fact, people were talking.
Butter in the coffee is a regular.
A stick of butter a day. Can you imagine your heart disease after this?
I can't remember chewing that kind of texture.
Oh, that would be nasty.
So gross.
So
gross.
I looked it up because I didn't want to critique this particular person without having backup. Yeah, it's utter nonsense. So there is very clear data from nutritional studies that demonstrates that eating 6 times a day is the best way to keep your health in check, to reduce your chances of heart disease and cancer, and to minimize the chances of diabetes. So the idea that it is beneficial for you to go on a carnivore diet and eat 1 time a day with a stick of butter is actually mental. Don't do that. It's terrible for you.
What are your thoughts on matrix testing? My RI swears by it. Also, should I take NAC, ALA, and curcumin on an empty stomach?
I don't know the specifics of whether it should be taken on an empty stomach or not. Ask the pharmacist. Do you know it?
General rule of thumb,
take it on a full stomach.
Never anything on an empty stomach.
Yeah, there.
General rule of thumb.
Dr. T's
Yeah,
advice.
I'll swing on that.
The problem with that is that some things don't absorb well unless you're on an empty stomach.
These are multivitamins.
Yeah, I don't know. I would talk to your pharmacist about that.
Disclaimer also, I am not a doctor.
There you go. That needs to scroll on the bottom of the screen. So yeah, as far as the are they talking matrix or matrix?
Matrix. Matrix testing.
I know of the matrix testing. I've never used it before. We are doing similar things from the Fertility tests. I've not done matrix before, but it basically tests for many of the same things. So I'm a believer for the stuff that it does test.
I think ovulation tests every day, but they never are positive.
Okay. Stop paying for tests and come see us because we can help you. That's easy. Yeah. You want me to take one from here?
Sure.
I have stage 4 endo, TTC for a year. I'm currently on 2.5 milligrams of letrozole. Does it actually help? Probably not for stage 4 endo. Stage 4 endo is bad disease. You probably have tubal damage, and the need for IVF is probably very substantial. I'm not someone that pushes IVF, but in that particular case, you probably will need IVF. Letrozole alone is not going to make that much of a difference. What is the impact of the letrozole? It keeps your estrogen levels low. The lower your estrogen levels are, the less inflammation from the endo. So that's the idea behind it.
Hi, Dr. V. I have stage 4 untreated endo.
Okay.
And my doctor recommended donor eggs.
Okay.
Before I go and drop a boatload of moolah on eggs, should I be worried about low implantation rates with said endo?
Yeah, of course. And why do you need to have donor eggs? I mean, before you do that, find out what your AMH is like, how accessible your ovaries are. Can they get them abdominally? Can they get them vaginally? How many eggs will you make? I mean, just because you have endo doesn't mean you can't use your own eggs. Is it harder? Yes. Is the egg quality lower? Yes. Are you going to make embryos that have a higher rate of genetic aneuploidy? Maybe. However, it doesn't preclude you from trying. And we have hundreds and probably soon thousands of patients that have had endo that we are successful with. So I don't ever tell an endo patient to go straight to donor egg unless they have an abysmal AMH or their ovaries are inaccessible, right? Like I have 1 or 2 patients where I couldn't even access their ovary even after surgery and they had terrible AMH. Okay, those patients probably need a donor. But aside from that, I wouldn't tell anyone that. No.
What do you think of pre-seed lube for TTC?
It's great. Pre-seed lube is expensive as hell, but it's decent lube and it's very good for your fertility. It's the best of what's available.
Any post-retrieval recovery recommendations?
Lots of protein, lots of Gatorade. Take it easy. Don't try and go right back to normal immediately. It's uncomfortable. You'll be bloated. Try not to get constipated, so avoid things that constipate you. Take some laxatives. And don't be shy to take pain meds. Sometimes you need them, and we're very liberal about letting our patients have the pain meds.
Should a 43-year-old who's regular and ovulating do an HRT or modified natural protocol for FET?
T, you want to answer that one? Modified natural or HRT, or do you want me to answer that one?
I think I want to go with I think first you got to start off with a good consultation to understand what's going on.
Okay.
I would say that's not the right first question. That would be, I'm like, you know what? We got to take a step back
and get the answers
and figure out what's going on, and
Sure.
then decide on protocol. I think jumping to this or that is a bit premature.
So studies show that the sequence of success and lowest miscarriage is highest success, lowest miscarriage is letrozole, then natural cycle or modified natural cycle, and then HRT. So HRT has the lowest rate of success and the highest rate of miscarriage. So my answer is after the consult, which T is right about, you would absolutely not do an HRT protocol. We don't use HRT protocol for anybody unless they're in menopause. That's the only time it makes any sense.
That's where the consult's so important.
That's where the consult's
Absolutely.
There you go.
Hello.
Yeah.
Not to me, not to you, just a generic.
Just a low. Okay, yeah. Neutral. They're Switzerland.
Yeah.
Yeah.
What supplements do you recommend pre-egg retrieval, especially for egg quality and dosages? Thank you.
Prenatal vitamin. I mean, there's no dosage for that. There's a million different things in it. Melatonin, 3 milligrams a day. Vitamin D, at least 2,000, up to 4 or 5,000 a day. Coenzyme Q10, 600 milligrams a day. If you want to really get bold, ALA is probably very beneficial as well, 600 to 800 milligrams a day.
Do testosterone and DHEA help the follicles grow in a batch?
Yes.
If you had follicles grown at different rates in the past.
Yes, it can. Yeah.
Why do you use testosterone with high? That's it.
You held that note for a while,
I
man.
thought there was like
Do you like sing in the shower too?
No, never. Never. I'm anti even speaking in the shower. Someone's looking around for me, not a word. I'm non-existent.
Oh, really?
I'm anti-speaking in the washroom.
Really?
In any capacity.
Oh.
I go in there, it's silence.
The cone of silence?
Code of silence.
All right.
And then someone knocks on the door. I'm like, yeah.
Well, you have 5 kids.
Yeah, there's a lot of knocking. There's a lot of knocking.
Yeah.
Right. Should you come off supplements before doing the fertility?
Supplements? No.
What is the optimal lining thickness for an FET?
8 millimeters or more. Less than 12.
Can priming with Omnitrope and androgel cause high estrogen?
Yes.
Is there any proof sex a night before the embryo transfer helps implantation?
Yes, there's another study I'll probably share with you guys next week. Although we've done it before, but it's worth doing again. Nookie the night before is a good idea. So there is an improvement in live birth rates if you have sex the night before. There are studies that have shown that the ejaculate primes the endometrium to facilitate implantation. So we tell our patients to just keep having sex. Yeah. There's a whole bunch of
Great
TikTokers.
medical advice.
Yeah.
Absolutely. Can you talk a little more why you don't recommend birth control in an IVF cycle? HX of Hashimoto's and unexplained infertility.
HX is history.
Uh-huh.
Reduces the number of eggs you're going to get, suppresses the ovaries, makes it harder to get good quality eggs, decreased live birth in multiple different studies. So we don't do it.
You have no idea how many questions we have. That's why TikTok is just like the queue is just
It's massive.
before we get to here. It's just
We're getting a record setter. I love it. That's
yeah,
good.
you got it right.
All right.
For sure. For sure. That's for sure. Hi, doctor.
Yeah.
My blood test results from
Yeah.
day 2 of cycle is below. Oh, I see. Below here in the comments. Could you comment if there's PCOS and about endo?
Okay.
So
Endo, no. I'm going to tell you that already. PCOS, what's the FSH?
she's got a bunch of stuff here, or someone.
I just need the FSH and LH.
Okay, FSH 6.8.
Yeah.
LH 9.0.
It's possible.
It's possible.
It's possible.
That's why you're the doctor, man. Once I see numbers, I have to give it to you.
When the LH is higher than the FSH, that's one of the hallmark signs of PCO.
Uh-huh.
Endo, you can't tell from any lab work.
As a doctor, what kind of topics would be too specific for a YouTube channel chat?
Well, technically, I can't answer someone's direct question about their care, right? Because you have to be my patient. So if someone says, should I do this? I always have to answer and say, well, we would do this. I can't tell you what you should do because you're not my patient. So I can't be that specific, but you can ask me anything. I mean, I get approached about everything from vaginismus to what to do about this kind of cancer or that kind of cancer to inducing breastfeeding and pregnant women. I mean, you name it, I get it all. So yeah, happy to help no matter what it is.
Hi, doc. How long should it take to get pregnant after depot, but I had nonstop bleeding for 11 months, and before that, I have a 6-week cycle?
Depo-Provera, that's an impossible question for me to answer because I would need to know the rest of your history. If your cycles were every 6 weeks, there may be something wrong, in which case you need to figure out what's wrong. So I can't answer that, although I can tell you that Depo-Provera can stay in your system for up to 18 months. So it can be there for a very long time. You gotta ask some TikTokers that they're gonna get pissed at me.
Before we get to the TikTokers, can the at-home turkey baster
Yeah.
method actually work?
Yes.
Oh, really?
Yeah. Yeah, there's a lot of lesbian couples that do that. They find a dude, they trust them, or they get them tested, whatever, and then they just have them ejaculate at their place, throw it in a turkey baster, fire away.
Shut up.
Yeah.
Really?
Yeah. All the time.
All the time.
Yeah. Common.
Common.
Listen, I can't necessarily blame them either, and I actually tell some patients to do it. But here's why. It used to cost $600 to buy a vial of donor sperm.
Okay.
Today I had a lesbian couple that was here, and they told me that the new pricing is 2,100 Canadian dollars. Went from 600 pre-pandemic to $2,100 to get a vial of sperm. Yeah, and that crap only works 10 to 15% if you're doing an IUI. So
Wow.
if you've got a dude who's willing to help you and you know he's squeaky clean, why wouldn't you?
Wow.
$5 turkey baster from the supermarket,
John,
and you're good to go.
good to go.
And it's not like as guys we complain about ejaculating. So yeah.
How do I make my doc listen to me when I'm complaining about my pains?
Oh, listen, I was telling my medical student about this today. And Tark and I were looking at my endometriosis video in preparation for making that. So in Canada, it takes over 4 years on average to be diagnosed with endometriosis, which is horrendous. And a big part of that, I own it as one of the brethren. It's because the doctors aren't listening. Now, I'm very proud to say I always listen and I always consider the potential for endo. And I tell my patients to consider getting investigated and evaluated for it. But there is absolutely no question whatsoever that most patients are getting horrible care for their endo. So how do you get your doctor to listen? You demand that they take it seriously, and then you threaten to complain. That's all you can do. And if that doesn't work, get a better doctor, right? I mean, we are out there. I listen to my patients. I listen to their story. I had a patient today that said for years and years and years, she had been told, take this painkiller, take more painkillers, just take painkillers. And I said, well, you probably have endo. And she said, why has no one said that to me yet? And I said, I don't know. I mean, we do a terrible job of it, but there's no question. Lots of people have endo. It's very prevalent. Why wouldn't we take that seriously? Why should it take that long for a woman to to receive a diagnosis? Granted, it does take a long time to get someone into surgery, and surgery is not without risks. But if the shoe fits, take the poor woman to the OR and figure it out. Not this nonsense of that's normal. I don't get it. I really don't.
If I'm not having my period for 6 months at a time, does
Whoa.
that say anything about my fertility?
Yes, you urgently need to go see somebody because either your ovaries are not working properly, in which case it could be a PCOS situation, which is very high risk for cancer, or you are going into an earlier diminished ovarian reserve situation. And if that's the case, you absolutely need to be evaluated because that is serious. So do not let that sit. You are at risk for cancer or you're at risk for premature menopause and you can lose your chance to have a baby. So don't be having periods every 6 months. I spend half my day saying this to people. So
age 37.
Okay.
Excision surgery for stage 4 endometriosis last August.
Okay.
AMH 0.94 nanograms per mil.
Not bad.
Endometrioma now 1.4 centimeters.
Oh, okay.
First egg retrieval, 6 eggs.
Not bad.
3 fertilized by ICSI. Stop growing day 3. Cells fragmented.
Oh.
Recommended to try Lupron and letrozole for 2 months, then try another egg retrieval. What are your thoughts on Lupron and letrozole prior to the second IVF round? Any other investigations recommended?
No benefit to Lupron and letrozole prior to IVF. Visan is the only drug prior to an IVF stimulation that has shown a benefit. You should consider using rapamycin. One of the studies we reviewed showed that rapamycin for a couple of months before your IVF protocol could improve your success rates. So that's sirolimus or tacrolimus. You could try Vizan if you're in Canada. If you're not in Canada, come visit us and we'll get you some Vizan. That helps. It's a very strong progestin with head-to-head comparisons to Lupron, which showed equivalent outcome and effect. But for IVF, they did trial it for 3 months before the cycle, and it did show a benefit. So those are all options for you. Supplements. So we use NAC, curcumin, resveratrol, ALA, and CoQ10. Those are all beneficial as well. Yeah, I mean, that's what we would do.
I think I may be pre-menopause. Is it possible to still get pregnant?
Possible? Yes. Difficult? Yeah. I'm sorry.
How long does it take to get pregnant after depot injection and I had
She asked that.
non-stop spotting for 11 months?
Yeah, she asked that one.
Okay. Uh, can acupuncture interfere with LIT?
Oh, great question. No idea. Um, I'm going to say maybe just based on how acupuncture works, which is we know for sure, whether you believe in acupuncture or not, that it can alter blood flow. So I'm going to say avoid acupuncture if you're getting lit.
Does an HSG show tubal damage from stage 4 endo?
Yes, it could. Yep.
Any supplements to stop after an FET?
Nope.
How common is secondary infertility?
Common.
When did the ERA test go away? I think I got that.
We stopped using it years ago. God, we stopped using it 2018, 19, around that time. It's been a long time for us. I haven't used it for a very long time. When did it go away? Kevin Richter, a well-known US fertility specialist, reviewed the JAMA article by Doyle et al., Doyle, where Doyle et al. Analyzed a randomized controlled trial for the use of the endometrial receptivity array, which showed absolutely no benefit. But the cool thing in that trial, and we have a whole video on this because I hate the ERA test, was that in the arm that was like the placebo arm, the control arm, everybody got an ERA, but they ignored the results and they just transferred all those people on day 5. So these are all people that had the test done, but then they ignored it and they transferred them all on day 5. So Richter went back and looked at the data within that group and demonstrated that in the group that got a transfer on day 5, regardless of what their ERA test showed, and they didn't know what the results were, so they were blinded, that the group that had the endometrium showing as receptive versus the group that showed as being non-receptive had absolutely no difference in outcome, which means the test can't even detect if you're receptive or not. It doesn't work. Like the test is fundamentally flawed. It's useless. And they proved that by showing that. You take everybody's embryos, you transfer them on the same day, regardless of whether or not they were receptive or non-receptive, they have the exact same outcome. So that means the test doesn't even work. It won't predict if you're normal or not. And then he did further calculations looking at what the rates were in the group that did do the endometrial receptivity array versus this group that didn't. And he realized that if you actually followed what the ERA test showed in the group that was quote unquote non-receptive or pre or post receptive or whatever, but that was still transferred on day 5, that you'd have a 13% decrease. So the ERA test is dead. It's deader than dead. Yeah. Oh, there's a great question. Can I
Go
take
for
this
it.
one?
Yep.
If you have immune issues, will transferring 2 embryos increase immune reactions versus 1 embryo? So it's a great question. There are some things we know about putting in a bad embryo which are concerning. Number 1, the cells of the endometrium do not like bad embryos. They don't like connect to them and attach to them. And number 2, there are signals sent out by the embryos locally that may not be so friendly to the other embryo. Good embryos send out good vibes. Bad embryos don't send out good vibes. So is it possible that your bad embryo could have an effect on your good one? We don't know, but it's possible, yes. So could that have some kind of immunological impact? Well, if the cells don't like your embryo, they're probably signaling something to come and clean up the embryo, which means the immune system's going to come riding in, marching in to kill that embryo off. Could it be a little more indiscriminate and kill another embryo that's nearby? I don't know. I mean, we're talking about billions of biological processes, but theoretically, it's possible. Yeah.
If I had a partial hysterectomy,
Yeah.
can I still donate my eggs?
Yes. Yeah.
Every lady has endometriosis. It's normal.
Who the hell said that?
Somebody.
No. Sorry, but that's absolutely not true. Not every woman has endometriosis, and it is definitely not normal. Don't mislead people with stuff like that. That's not true. You got to verify, and it's 9 o'clock. Are we done? Thank you, everybody, for joining us on Fertility Factor Fiction. We are super pleased to have you here. Thank you for making it our biggest show ever, apparently. It was great to have you guys on. We will be back again next week with another exciting show. I will maybe do the sex the night before, although it seems pretty primitive, or hopefully we'll find better articles. And I will keep scouring the internet for you to find the latest and greatest and provide you with the best information possible. And a huge round of applause to all the nurses, especially mine, because we have our biggest month of IVF ever coming up this month in May. It's absolutely insane. We are doing in the month of May more than half the number of IVF cycles that I did in an entire year when I was at my old fertility clinic.
Wow.
Yeah, pretty cool. Yeah, yeah. So thank you for helping VRC grow. Thank you for your patronage. Thank you for your warrior natures and for plowing on when it gets really tough and difficult. And we will see you again next week on Fertility Factor Fiction. Have a great night. And remember, 2 embryo transfers may be a thing. It may be. I know I'm going to be hated by all the fertility